So I would like to talk to our next speaker, Dr. Lee Newman. Dr. Lee Newman is going to talk about total worker health approach to occupational health surveillance, the U.S. Department of Energy Former Worker Program. And let me tell you a little bit about Dr. Newman. Hi, Lee.
Hey.
Lee Newman is a distinguished university professor in the Department of Environmental and Occupational Health and Department of Epidemiology at the Colorado School of Public Health at the University of Colorado. He is the founding director of both the Center for Health, Work, and Environment, a NIOSH Total Worker Health Center of Excellence, and a Mountain and Plains Education and Research Center, a NIOSH Education and Research Center. Dr. Newman is internationally recognized as both an occupational health and safety educator and for his scientific and practical contributions to total worker health, occupational lung disease prevention and treatment, the epidemic of chronic kidney disease of unknown cause, and solutions directed at mitigating the effects of climate on worker health and safety. Thank you, Dr. Newman, for taking part, and the floor is yours.
Okay, what I'd like to do today is, and it's hard to follow Bob Harrison. I've known Bob for a long time, and that passionate presentation is really such an amazing illustration of something which I actually want to start with, and that's the observation that the work may end, but the risk does not. And so what I'm going to talk about today is work that we've been doing around addressing surveillance needs of former workers through a total worker health lens. And so let me go ahead and dive right in. I want to give my disclosure, which is that I'm the co-principal investigator of something called the National Supplemental Screening Program, which I'll be talking about, which started in 2005. I'm also the former CEO of a software company that provided actually the platform, the technology platform for a nationwide surveillance program. No longer part of that organization. We're funded by the U.S. Department of Energy under a cooperative agreement with Oak Ridge Associated Universities, ORAU, and I receive no personal compensation, benefits, or have any other conflict of interest to declare. The partners on this project include Acuity International, our center, Cority, ORAU, and National Jewish Health. So let me shift our gears to this lens of why should we be screening former workers? And the program I'll tell you about today, which is for Department of Energy site former workers, is not unique. We've been doing this through the federal Black Lung programs for coal workers. When I entered the field of pulmonary medicine in the mid-1980s, one of the first things I was involved in was a project looking at cases of silicosis and black lung through screening and surveillance programs, acknowledging, by the way, Bob's discomfort with those terms. But those screening programs for black lung benefits, you think about the World Trade Center Health Program and its medical monitoring program that's been in place since 2004. The Veterans Administration provides screening for work-related health conditions, as well as health promotion and disease prevention programs. And those are some, just to place this in context, some examples of programs that address not only the needs of current workers, but former workers with exposures that have legacy effects on them, such as silicosis. So I'm part of the U.S. Department of Energy Former Worker Program, which was established as part of the National Defense Authorization Act in 1993. Exams in those programs started around 1997 after several years of a variety of academic institutions examining what were the exposures at various sites across the U.S. At national laboratories and sites that were involved in the production of nuclear weapons. We began the National Supplemental Screening Program in 2005, and I'll tell you a little bit about that. So there are 6 Department of Energy programs, 2 of which have national reach, and the one I'll talk about today is the National Supplemental Screening Program, NSSP. There's also our sibling program is the Building Trades National Medical Screening Program. And then there are these other individual programs as well. I've put on this slide our shared testing protocols because it's something which is coordinated through the U.S. Department of Energy, but is really the collaboration among the many investigators from academic institutions who run these programs and collaborate on developing our medical protocols for identifying work-related health problems that are appearing after a period of some legacy. The former worker participants, you can get an idea here that they are from across the US. There have now been literally hundreds of thousands of exams provided through these programs going back to the late 1990s. Our program, the National Supplemental Screening Program, like the others, are exposure-based medical screenings that were specifically developed to identify work-related health conditions related to exposures at these weapon sites and national laboratories related to radiation, a variety of metals, acids, solvents, noise, chemicals, respiratory irritants, cigarette smoke, lasers. They're algorithm-driven and intended to identify predominantly work-related health conditions. But that being said, it was obvious to us that these former workers, many of them who are retirees, average age around 62, 63 years old, had the potential of benefiting from something more comprehensive, something that addressed both work-related as well as potentially non-work-related health conditions, including screening for diabetes, hypertension, cardiovascular disease, cancers, and thyroid conditions. And so in this sense, and we've published on this, and I'll give you the references at the end, we've viewed this as actually a total worker health program. It's a concept of thinking about, yes, safety first, exposure in the workplace first, and those health hazards and the health conditions that we can detect, but at the same time having an opportunity in a more integrated way, a more holistic way, considering what are the health conditions that are being experienced by these former workers, an opportunity to be more comprehensive and potentially more beneficial to their health, even beyond the detection of work-related conditions. This is a sketch of our program. This is actually, ignore the N, the number. We are now well beyond 22,000 exams. But this just to give you an idea, we provide, we obtain an occupational exposure history. People volunteer to enroll in this. They also have the opportunity to continue and get 3-year reassessments, because we know that over time, many of these conditions, even if we don't see them the first time that they go through the screening, we may detect health conditions the second time. So we follow an exam algorithm, and we also apply U.S. Preventive Services Task Force principles in looking at the personal health conditions that we can screen for, as well as the work-related health conditions. For the National Supplemental Screening Program, this will give you a sense. Our primary sites are indicated with the white dots, and so you can see the number of participants in the ballpark of how many we have screened. But we service the entire country because former workers move. And they may be now living in states that are quite remote from, say, if they worked at Los Alamos National Labs, they may no longer be in New Mexico. And so they volunteer to participate from wherever they're now living. It presents some interesting challenges to create this kind of national reach program, which, if there's time, we can chat about. I just want to punctuate for you just a few of the results, and these are through August of 2022. Up to that time, we had screened over 20,000. We did press pause during COVID, during the peak of COVID, and did a lot of shifting of gears to make sure that when we did start offering exams within 35 miles of a person's home through more than 10,000 clinics, that we could do that safely for the clinics as well as for the participants. So up to then, we had performed 27,000 exams with former workers at 81 Department of Energy sites, including also 8 of our primary sites assigned to us by the Department of Energy to put our main emphasis. Importantly, 34% of the people who have gone through this program have needed follow-up for what are suspected occupational conditions. I'll come to those in a moment. But just think for a minute about the implication of that number. 81% of them needed follow-up for what I'll call non-occupational health conditions. A very striking number and really an indictment of our healthcare system and the fact that we don't have sufficient health coverage for all Americans. This will give you just a snapshot of some of the what I'll call occupational conditions that we have screened for and identified, and then provided information back to these workers for them to be able to pursue further, either for compensation and or for further medical evaluation and treatment. Peculiar but not unique to the Department of Energy complex, for example, is beryllium sensitization, the immune reaction to the metal beryllium, which leads to chronic beryllium disease, various dust-induced lung diseases. The darker bars show of the people who were screened, the percentage of them who ended up needing referral for these suspected conditions: lung nodules, silicosis, asbestos-related conditions, noise-induced hearing loss. If you look on the non-occupational side, a very high proportion of them detected with elevated hemoglobin A1Cs, abnormal thyroid function, blood in their stool, elevated blood pressure, elevated body mass index. So it gives you an idea that a surveillance program, a screening program like this, has the capacity to detect work-related conditions as well as or probably not work-related conditions. Just as a highlight, because I want to leave time for questions and discussion, this is an illustration of an integrated, comprehensive program designed to provide important benefits to workers. And I just want to comment that to serve workers, what we want to be able to do is have something that is comprehensive, that can address both the work-related as well as the non-work-related health conditions that they have the right to know about. We want it to be done in an ethical way. We want the information to be understandable, and importantly, it needs to be actionable. And that might be in the form of a compensation program, which these workers, many of them qualify for and have received benefits under a Department of Labor program called EEOICP, an act of Congress that compensates them and provides medical care for them for work-related conditions related to employment in the Department of Energy sites. What we're showing here is that you can do tailored screenings that are driven by the information from workers and what we know from their work sites. It's feasible on a large scale. We're finding that rescreening is important. I didn't show you the data for it, but we continue to find incident diagnoses of these diseases of latency. It's important that the recommendations be clear and that there be pathways for medical follow-up. And we can, if there's time, we can talk more about that. We relay this information to the participants, to these patients. They have the ability to then share that with their physicians. We often end up on the phone with their physicians to discuss the results, and it also cues them up to apply for compensation. It shows the importance of having pathways for workers as well as for survivors' compensation programs. And it leads to my final question to all of us, which is, what are our ongoing obligations to the American workforce, even after the time that they may no longer be employed directly in a hazardous industry. I have these acknowledgements to the U.S. Department of Energy former workers who have participated, to the U.S. Department of Energy EHSS office, my colleagues at ORAU, my collaborators at the NSSP, and our University of Colorado team. Here are a few references and a shameless plug for the Society for Total Worker Health, which launched this past fall. I'm very pleased that Christina and Ed and others have joined among the 200 or so of us who are now founding members of the Total Worker Health Professional Society, which is extended to people in academia, in industry, in labor. So check it out.